He's going to test all of them in a second. All right. And thank you all for coming tonight. And we'll explain and give the purpose and the main reason why as we're saying hello to everybody. But we want to tell you all thank you. We know how critical this conversation is, and your input and insight is valuable. And so we want to thank you for your time and effort for being here today. Of course, honored to have Norman Robinson, one of the great journalists of our, iconic journalists of our day, to lead the conversation with us. So look forward to a great time with everybody tonight. Father, bless us, keep us, in Jesus' name, amen. Testing 1 2, testing 1 2, testing 1 2, testing 1 2.
Testing 1 2.
Are we going right on at 6:30? No, all right. Is the flyer up online now at 6:30? Can we back up a little bit? Help it down. Are we checking everybody's mics? All right. Yes, I want them to be comfortable with the...
Wow.
Wow.
Okay. Major conversation that needs to be continued. We remember, Pastor Fran, when we got the news here at the City of Love that the city was going into a shutdown because of COVID.
Yeah, it was a frightening time, Bishop. People were very, very concerned and very, very uneasy. Anxiety was at an all-time high.
As well, they should have been. They should have been, because there was so much information. There were so many things we just did not know. And we had to remain fluid, and we had to remain flexible. And so as this COVID conversation began to grow, then it became a conversation not just of people getting sick, but about vaccinations.
It became a decision, a choice that everybody has to make. You know, you decide if you're going to be vaccinated and if you're not. But here is my statement to, like, those that make decisions. You know, make sure whatever decision you make, you can back it up. You know, make sure you talk to those people that you trust, your doctor, your scientist, your pharmacist, your educator, but talk to someone. You know, just don't say, I'm not doing it just because I'm not doing it.
Right.
The Bible declares in all thy getting that we should get an understanding.
Right.
And that's the reason why we're here tonight, so that we can be so that we can get an understanding.
Absolutely. And I was one of the people in the beginning that was skeptical also. Because of the way I eat, the way I work out, all of these different things. But the more information I got, I was able to make the decision that worked best for me. And that's what we want you to do. Listen to the information and make the decision that is absolutely best for you. And we have an iconic leader, not only in our community, but also in the journalistic world. He's one of the first African Americans to host a major television network news as a news anchor. We're honored to have with us as our host for today, Norman Robinson.
Thank you. Thank you very much, Bishop Love, and thank you, Pastor Fran Love. You know, this is an opportunity for me to share my story and my testimony. Bishop Love talked about being hesitant in getting the vaccine, and I know that Pastor Fran has compromised conditions that she's concerned about, and I was like the bishop. I thought, I'm strong, I'm healthy, and I look pretty good for a 70-year-old. And I didn't think that I was going to have any trouble with COVID. And it turns out I caught COVID in January, and I had it the whole month of January and half of the month of February. And I have to tell you that I have never experienced any pain that comes close to COVID in my 70 years of living. In fact, I thought I was wrestling with the devil. And I've never shared this actually with anybody before now, and I will share it because of the environment. And I'm in the church. I thought I might have been possessed by the devil. It was a very evil, foreboding kind of feeling that you just wanted some relief. I said to God, if whatever it is, if you want to take me, go ahead and take me, but I got to have some relief. I would crawl to the bathroom, and I would lie there on the floor. I would sit on the commode and didn't have the strength to get myself up. My wife would walk through the room, and the last time she walked through the room when I was at my gravest point, she said, I thought you was dead. Your eyes had rolled back into your head, and I thought you were dead. And I made a frantic call to my doctor. I said, I got to have some relief, doc. And he says, I'm going to prescribe a steroid pack for you. That might give you some relief, but whatever you do, don't go to the hospital. Because at that time, they were really experimenting with this virus. They really didn't know what really worked. And he was afraid that they were going to intubate me. You know, that intubation device is that steel rod that they shoved down your esophagus into your chest area. And a lot of people don't make it after that. So I'm here as a proponent of doing whatever you need to do not to get COVID, because you don't want Rona on you. Believe me, I'm here to tell you, I wouldn't wish that on my worst enemy. And tonight we shall endeavor, as the bishop said, to have a discussion, a frank discussion about COVID, about the vaccinations, and where the church stands on this. Let me introduce our esteemed panel, and then we will start with Bishop and with the pastor on where the church stands on COVID and vaccinations. So let's begin, as they say on Family Feud, let's meet our panelists. Dr. Alicia Reed, clinical pharmacist. Dr. Jolisha Eubanks Jones, OBGYN, Oxnard, West Bank. Andrea Jones, and Andrea has been vaccinated and had COVID, am I to understand? Hadn't had COVID. We will hear her story. She's the rebuilt CEO. And Yoshika Williams was unvaccinated, is unvaccinated, and has COVID. And she's trying to get COVID, but I think she was given some information that was a little inaccurate. And we will have a discussion about that on her behalf tonight. And I'm glad I'm here to participate. And Lauren LaDuff, one of my friend's daughters, which ages me, Lauren. She's the assistant principal at Warren Easton. And Jashad McCoy, who is unvaccinated and had COVID. And Jashad is an entertainer. So let's begin our discussion with where the church stands on this issue of vaccines and the COVID pandemic. Bishop?
One of the reasons that we're here is to get as much information out as possible. I believe one of the things that we are challenged with now is not necessarily just getting the virus, but in your case, how sick do you want to be if you happen to get it? The discussion is not around whether or not you can catch COVID, because anyone can catch it, but what plans do you have when it comes to sickness? Now, let me talk about the church. The sons of Issachar understood the times, and they knew what Israel ought to do. They understood the times and knew what Israel ought to do. We live now in such a rebellious generation. Now, much of our rebellion is not necessarily coming from the fact that we are rebellious people, but there's so many injustices that have been inflicted upon us that it causes us to be hesitant anytime any type of law or any type of rule or any type of government is forced upon us. I'm not sure if it's the church's responsibility to enforce the laws of government. I'm not sure that is our responsibility, but our ultimate responsibility is to make sure that we create an environment where people are as safe as possible, as they possibly can be, with the hopes that they not only consider themselves, but consider everyone else around them. And everything that Christ did and everything that the church did, they gave people a choice. It's freedom of your own choice. And in this particular case, your choice is more detrimental than a sin that no one else can punish you for but God, but your choice could be your life. And so the church is here not only to be a part of the community and lead, but also listen carefully to what our people are saying to us so we can properly administer the spiritual medicine that they need to help them make the best choices that they can make.
And Pastor, as a spiritual leader who is immunocompromised, where do you see yourself on this issue?
As Bishop has said, with the church, the body of Christ, salvation is a decision. The Bible says this about the man at the pool of Bethesda. Jesus asked him, "Do you want to be healed?" Which simply says that healing is a choice. And even when it comes to the vaccination, this is a decision that each individual must make. Just like salvation, nobody can force you to accept Jesus Christ as your Lord and Savior. But we live our lives as examples. The Bible says, living epistles read of men. And so when it comes to the vaccination, I want people to know that I am vaccinated by choice. I was not forced into it, but because of my compromised immune system, I made a choice for life, for me personally.
Thank you very much. Sounds like myself after that bout with wrestling with the devil, I ran down there to get my vaccination. And I said, "Can I have two?" They said, "No, you got to wait. You got to wait a couple of days before you get the second one." And I want to begin with our panelists, but I want to begin with our panelists who have had some kind of either exposure to COVID, or our panelists who are thinking about vaccinations and haven't been able to get them. And I pointed out earlier that Yoshika was unvaccinated and wanted to get, and she had COVID, and she wants to get vaccinations, but you've been told two stories. One that said you got to wait 90 days, and another story that said you got to wait 30 days. So what's your thinking now?
Well, for me, it's more so of just trying to find consistency in answers. It's very difficult once you had it, and severely, for me, it was breathing. And then I wasn't the only person with it. I have a 4-year-old, 11-year-old son, and a 4-year-old daughter, and my husband had it as well. So we all had it. So I'm helpless. I can't help. We can't help each other. No one can come in to help us. It was more of grateful of my bishop and my pastor friend. I was able to talk to them hardly because every time you speak, it's the cough that's very uncomfortable to bear. So it was more like, I don't want to talk to nobody. I'm going to just try to get through this. I got to try to heal my baby because she's 4 and she's struggling too. So it was just very inconsistency once we got through that process of the healing water that we actually needed, that really, 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 really worked. And I was the person that experienced I couldn't bear it and made it to the hospital. And once I got there, I knew what it felt like to be thrown away.
Mm-hmm.
And it's crazy because they were okay for you sleeping in a waiting room, and I couldn't walk. I was in a wheelchair. So I was like, I can't stay here. So I took whatever strength it was, and Will Donna was like, come and get me. I'm going to go home. I'm so grateful for the people that were close to me that knew. Pastor Fran was definitely on it. Her and Bishop was on a go. Like, I had an oxygen machine, oxygen meter. I was taking different things that's trying to make everything heal for all of us. When I took it, everybody took it. So it was just difficult. So once we got past that, it was more like, okay, I'm going to get vaccinated. I want all of us to get vaccinated. Now, I know my 4 and 11-year-old wasn't able to get vaccinated because they were at that peak of age once they started. But when it came to me and my husband, it was more like we went to the place. It was like, oh, you got to wait 30 days. Wait, hold on, let me be sure. So you're communicating with a pharmacist. And then when you go to the hospital, it's like, oh, no, you got to wait 3 months. You got to wait to 3 or 6 months before you really get vaccinated. So I'm like, listen, I'm about to schedule this, and we're going to go ahead and get vaccinated, whatever they saying, whatever it is, until they figure out what the actual time period of people having it and actually is able to take the vaccine. I'm going to just go ahead and do it. But, of course, I had a hit. So everything just went haywire.
So you're waiting to do it.
Yeah.
And
like
as soon as you get an opening, you're in there.
Absolutely. And it's difficult even now that you're home, and I didn't think of it once we evacuated. It was more of like I could have, but then could I actually in another state? Because you really don't know. Because it was so difficult here, and when you got here, everything was just in limbo. And it's,
Can any of the medical experts on the panel share with her as to what she should do in terms of having access to getting a vaccination as soon as possible?
Have you spoken with your provider, your healthcare provider, about it?
Yes, I did. But the day I was supposed to see them, on the 9th of this month, everything was dismantled. So it was more like, okay, now I got to wait even more because now they have to get their facility together for me to even enter. So I'm like in pause mode. So I'm like, I'm not going nowhere. I'm inside. They not going anywhere. They can't go. Nobody can. And my daughter's school started. My son is back virtual. He's not in school. His first day was on the 6th. He has never been to school since COVID opened. I haven't worked since July 30th, since I received that notice. So we all just been inside. My husband was the only one that got better, but his job is more convenient. He's only in the truck, so he drop containers off. He don't have to interact with people in and out. So we just inside and pretty much waiting.
Yeah, I mean, my recommendation would be to follow up with a healthcare provider. If you can't get into that office, there should be someone else who should be able to see you and guide you. Of course, I'm going to recommend that you get vaccinated.
Absolutely.
Because it keeps you alive.
Right.
So.
And I went to the emergency room because my sugar, I also have sugar and I take pressure pills. I have high blood pressure. So my sugar was at 460. And it would not budge. It kept elevating. So when I got there, they were like, oh, we can't do anything. We can't just don't come back here because you will get sick. I'm not going to let you leave unless I know that you're negative with COVID. They immediately test you. They made sure I didn't have any blood clots, checked every single thing. But my last results was the test to leave or not. And once I left, he was like, don't come back here. So you won't get sick. So I just been inside and kind of waiting it out, calling my physician to see when is for me to get there.
Yeah, I mean, I will assist you if
Okay,
you
yeah,
That's
absolutely.
what I want. That's what I want to hear.
Like
That's what I want to hear. I
tomorrow.
want to hear the
Yeah.
connection.
We can
want to-
exchange information and then I can follow up with you.
Absolutely, so we can get it done.
Yes.
Yes.
I'm not really sure what information you got or from whom, but according to the CDC, unless you got the monoclonal antibodies, and you and I spoke a little bit before this started that you didn't, but as long as you didn't get the monoclonal antibodies, once you're out of isolation, once you're feeling better, you can immediately go get the vaccine administered. Now, there's some hospitals, of course, this whole COVID vaccine, all of it, a lot of it boils down to having a healthcare provider and someone who actually knows pathophysiology, meaning the disease process within the body and how things work, that you trust. It's difficult, especially for us as African Americans, to trust the healthcare system, to trust the government based on our past and things that have happened to us in a not so distant past. But you need to find somebody that you can trust and who can be honest with you and who can actually just tell you what's going on, because getting different kind of information from different sources is what's causing the progression of this issue. But the bottom line is, yes, you can get vaccinated. Your husband can get vaccinated. Your kids cannot. Your son can't get vaccinated until he's 12 with the Pfizer, and your daughter can't get vaccinated, obviously, until she's 12. But you can immediately go get vaccinated. Ochsner, I know for sure, we have a walk-in clinic. Literally, I'm on the 3rd floor. On the 1st floor, you walk in, you tell them you haven't been vaccinated, they administer your vaccine, they schedule your next appointment, and they issue you a card. No questions asked. So, again, as long as you haven't had the infusion of the monoclonal antibodies, which at that point you have to wait 90 days. But that outside of that, once you're out of isolation, once your symptoms have resolved, you can go get vaccinated.
So she doesn't have any of those issues that would preclude her from getting a vaccination.
She can go get vaccinated when she leaves here. Well, everything's closed, but tomorrow.
And you mentioned, doctor, I think that kids from 12 to 18 are eligible for the vaccination.
Yes, they are.
Not?
12 to 18, or it has been approved, FDA approved for them to be vaccinated. Yes.
And are they now working on a vaccination for, say, 2 to 4 year olds?
Yes, they are. They are. So that's in trial periods as well.
All right. We've heard from 3 of our panelists. Now we want to hear from the other 3. Let's begin with Mr. McCoy, Jashad McCoy, unvaccinated COVID entertainer. So what is your story and what are you looking to accomplish?
So first I want to know why you ain't announce everybody is vaccinated or unvaccinated. But I'm going to go ahead and go on.
I just take that was a personal preference. That was,
Hey, Ru, hey,
some,
they got
some people,
unvaccinated.
Some
my
people
name.
are more
All
open
right?
than others.
All right. But so I'm unvaccinated. I'm totally against it.
Mm-hmm.
I don't believe nothing. I had it. I felt fine. I ain't had none of y'all story. I was still running out, jogging, doing what I was doing. I just feel like a lot of the things that's going on, the mandates, the things they telling us to do, a lot of it, in my opinion, doesn't make any sense. Mm-hmm. You go to the airport, you stand in line 6 feet away from the people in the line, then you sit right next to them on the plane. Mm-hmm. What was the purpose in the 6 feet? Mm-hmm. Like, you're going to be on a plane with them for 3 hours. I done been on planes jam-packed. What was the purpose? That's one thing. Then right now, my son called me today. He's 16. We had a conversation maybe 2 months ago. He said, Dad, I don't want to get vaccinated. I said, all right, the choice is yours. However you want to do it, that's what we're going to do. Then he called today. He said he's getting vaccinated because to play football, baseball, basketball in high school, you got to be vaccinated. But you don't got to be vaccinated to go to school. So what is the purpose? You go to school and not have to be vaccinated, but you have to be vaccinated to play sports. What's the difference? You're still around the same children all day. So I just feel like a lot of the things that's going on is like a lot of inconsistency in the research. There's a lot of inconsistency in, just everything. And so I just feel like at this point, they forcing an agenda, they mandating it. And I just feel like as people, you can't give us freedom of speech, freedom to do what you want to do. You got, people they can identify as a woman. I can sit right here in y'all face, you could clearly see I'm a man, but if I say I identify as a woman, you got to respect my decision. Now, I feel like in life, you can't give us all of those different decisions and then turn around and say, no, but you got to take this to do the regular things in life. They mandating the nurses and stuff, the people who work for the hospital to be vaccinated, making people make a hard choice. I feel like if those are the people in our community who could save us or who are saving us, they made it through the whole beginning of COVID with masks, gloves, making it, without getting COVID. So now you're forcing them to take a shot or whatever. So if the people say they quit, you got half of the people who was taking care of us with an already run over system. Now you're gonna make people make a decision. If you start losing the nurses and stuff like that, now what we facing?
Yeah. Did you have COVID, by the way?
Yeah, I had COVID about 2.5.
How did it affect you?
I had a headache. I had a cough for maybe 4 days. But, outside of that, I felt fine. I didn't have any breathing problems. I was still able to function and do.
So you had a mild form of it.
I just had my form. I feel like
your form was a mild form.
Well,
it didn't knock you out.
Well, I don't know.
You can still function.
But because I feel like it's just going to affect everybody differently. So
Yeah,
I feel
it
like,
does.
Right. So I feel like the research is really pointless because you don't know what it's going to do. So right now, you want me to go take a vaccine for what? I had it already. I feel like if I get it again, my body technically already done been exposed to it, so it should be better the second time if I do get it a second time. So, that's essentially what the vaccine is supposed to do, put a little bit in you so you know your body recognizes it and can fight it later on. So at this point, I feel like I done had it, and I was fine the first time. So,
So you're all good. But I noticed that you're wearing a mask.
Because they told me I had to put it on.
You had to put it on? So you are respecting other people in terms of that. So that's good.
I don't want you to think, if I could avoid getting it, I ain't trying to get it. But, at the point where we are right now, I feel like all the money that they gave people when COVID first started for his unemployment and just PPP and all the different things, I feel like had they taken that same approach and just shut the whole world down for 90 days and gave people the money, we might be in a different situation. They got to figure something out. At this point, I just don't see forcing people to take the vaccine. I don't see how, I don't see anything, any data that confirms that you're going to get a mild case or, like had I had the vaccine, they'd say, see, if you would have had it, and if you wouldn't have had it, you would have been, oh man, you'd have been bad. But I had it and I was all right. So now, what are you gonna say now?
Yeah, it just affected you differently. That's what
what
I would say.
Right.
Yeah. So who wants to talk further about the position that Mr. McCoy has taken? He's perfectly within his rights to decide whether or not he wants to take the vaccine. So is that a good position to take, or whether or not it's a good position to take, it's your right to take it. Is that a position that you feel comfortable with?
Well, I think, yes, absolutely. You have the right to decide whether or not you want to take the vaccine. I think a lot of people miss that we've been required to take vaccines for our entire lives. It's just that now this is COVID. When you're born and you're at the hospital, and then when you go to school, your parents made that decision for you to receive a vaccine. And that's why you don't have polio. You don't have all of these other diseases that were prevalent at that time because you were vaccinated. And a lot of the misconceptions are about how fast the vaccine was developed. And I think we don't realize that it's an mRNA vaccine, which is different from the vaccines that we've had in the past. So it's something that was studied. It wasn't just they didn't just start studying it when COVID appeared. SARS has been a virus that has been around for years. So that technology was already in place. Those studies were already going, and it just so happens that, COVID came and they had already started working on it. So it's like if you're in a lab doing something and all of a sudden, I've already studied that. So here, let's create the vaccine that can help save lives. And I do understand, the apprehension because, someone's telling you to, get a vaccine and, you want to have that right, you want to have that choice. And I understand that. As a healthcare provider, I still have to go to work. I'm doing the best that I can to stay safe. I got vaccinated. I'm being exposed every single day. And I'm being exposed to not just, patients with other diseases, but COVID patients who have chosen not to be, vaccinated. And I go home to a parent who's immunocompromised. I have a son who cannot get vaccinated. So it's like we're putting our lives on the lines to protect and serve people. I mean, that's what I went to school for. So I think just the conversation about, what's right and what's wrong, it's just really thinking about other human beings and just respect for life. And the vaccine, they never said it would keep you from getting COVID. It said that it would keep you out of the hospital and potentially avoid death. And there are studies that I read them every day. So the data is there, and I just want people to make informed decisions. You're entitled to your opinion, and I respect that. But I want you to see the data and see where it's been studied and it's been proven that it is keeping people out of the hospital. And then there's treatments that people are getting that haven't been studied as much as the vaccine. And it kind of baffles me because people come to the hospital at that point wanting to be treated. They want to be saved. And it's like, okay, you're going to take the treatment that we're going to give you, but it hasn't been studied. It's not even FDA approved. It just has an emergency use authorization. And you're getting this monoclonal antibody that, can potentially save you, but why not just get the vaccine?
I mean, so what do the studies say? I mean, I hear you, people just throw studies and this is what's happening, but like, so when you look at the numbers, so let's look at it from the very beginning, when nobody knew anything about COVID. When you look at that, and they were like, the hospitals were being overrun, and they didn't have the staff, and et cetera. So now you say 50% of America is vaccinated, and so whatever that number is, I don't really know the exact number, but so when you look at the numbers, you would say, well, if there's a new variant, a breakout, and the hospitals are still overrun, then something would tell you that if you got half the people, why are the hospitals still being overrun with half of the people? That's kind of like when you get traffic in the morning because everybody going to school, everybody going to work, but when children out of school, you ain't got no traffic because ain't, it's wide open. So in my opinion, I feel like a lot of the studies that they're saying that they're doing, they're like, all right, so I'll break it down like this. If you tell me that somebody is better off because they have the vaccination, right? There really isn't a way to study that. Hold on, I'm gonna break it down to you why you can't study it. No, I'm gonna break it down to you and then you'll tell me because I know you got your little.
He's gonna break it down.
Nah, because I'm just just my logical thinking.
Oh, you're very logical.
Right. So if you have a person and you want to do a study on a person and say, well, I want to test him versus if he's vaccinated, how would he be affected versus non-vaccinated? Once he's been vaccinated, you can't test him on being unvaccinated and vice versa. Once he's unvaccinated and had it, you can't give him the vaccine now, and you can't say, oh, these two people are similar because it affects everybody different. So you don't really know if somebody is better off or worse off getting the vaccination, and there's side effects that they just not really talking about that people are having. And I'll let you respond to that, and then I'll talk about side effects.
So everything you're saying is completely logical. Yes, there's a lot of inconsistencies that's going on because I think we're at a point where the world was locked down for some months, right? People lost money, people had no jobs. So there was a cross between how long do we shut the world down versus people riding in the streets saying, when you gonna let us to go back to work? So, right. So we're telling you, keep your mask on, stay 6 feet apart, and then we sit you next to, or they're sending these kids to school. Do I think that's the best thing to do? No, I think that's insane. I think everybody should get vaccinated, but you do have your choice. I think the difference between, I think that Pastor Fran talked about salvation. The difference between salvation and COVID is only your soul is being affected versus whether or not you get vaccinated, it affects the person next to you. Because if you have COVID, you can give it to her, and who's going to give it to her, who's going to give it to 20 other people. So if each one of y'all touch 20 people a day, and those 20 people touch 20 people a day, it's spreading like wildfire. As far as studies are concerned, there's never a study that's, just in science in general, there's no study that has test subjects where they're studying one person versus another person. All studies, they're looking at groups, whether it's a randomized controlled trial where it says, I'm going to give you a pill, and then I'm going to give you another pill, and I'm going to see how this affects y'all, and these will be the results. Or there's something called retrospective studies where we already know that this group of people were sick with this, and this group of people are exposed to that, and so let's see how these people fared out. So the studies that they're doing is not you versus you. It's this group, unvaccinated, versus vaccinated, and there are numbers. The numbers are very, very clear. Just in Louisiana, 90% of people, 90 to 95% of people who are hospitalized with COVID are unvaccinated. 95% of people who die from COVID are unvaccinated. That's straight numbers. And this is in Louisiana. This is like they counted 1, 2, 3, 4, vaccinated, unvaccinated. So when the people say to me, well, you can't prove getting vaccinated helps, it helps. Now, you had a mild form. Thank God, you were very fortunate. Versus he did not. He was crawling to the bathroom. Other people are, like, the numbers don't lie. People are dying. 4 million people have died. They have more people who have been infected and died with COVID than HIV. So we talk about HIV all the time. People are going to wear a condom. People are going to ask you, hey, have you been tested? Why aren't you going to get vaccinated? Not you. What's the deal with getting vaccinated? And as far as mandating it, the reason to mandate it, all vaccines are mandated. You can't go to college without a meningitis shot. I got to get a flu shot every year. It's on my ID. I have to have a sticker that says I had the flu shot and I work in a hospital. All those nurses and all the people who are against the COVID vaccine who are going to whether lose their jobs or get vaccinated, they get a flu shot I had literally had to see, I'm afraid of needles. Yes, I'm a doctor. Yes, I did a hysterectomy this morning, but I have a needle phobia. So literally the COO of my hospital, of Ochsner System, called me and said, Dr. Eubanks, when are you getting your flu shot? And I was like, okay, I'm going to go today before I lose my job. So as far as, not today, that was last year, but as far as the COVID vaccine, as far as mandating is concerned, we're always mandated. You cannot step in now, before, we probably got the chicken pox. These kids have to have a chickenpox vaccine before they go to school. So it's not that the choice is being taken away from you all of a sudden. There's always been mandates for vaccines, and the numbers are there. Does it make sense that we're letting people sit on planes? Does it make sense that we packing these students in school and then standing these teachers up there, and these teachers are getting sick and these kids are getting sick? No, it doesn't make sense to me either. But getting vaccinated makes perfect sense.
I'm so glad we're having this discussion. I really am. This is the kind of discussion that is so badly needed. An even-tempered, intelligent discussion about the pros and cons of what we're faced with. This is beautiful. I don't know who chose you to be on this panel, but they did an excellent job. I'm glad you're here. I really am. I'm glad you're here because you make a lot of sense for people who might be against getting vaccinations. And there is a lot of confusion out there. There is totally a lot of confusion. The president got on TV a couple of weeks ago and said everybody ought to have a booster. And then the FDA and CDC came out and said, no, not everybody doesn't need a booster. So there is a lot of confusion in the atmosphere. And discussions like this help us arrive at an intelligent point of discussion so that we can kind of see where the facts are. And so I appreciate your position, and I appreciate the way you present your position. So thank you for being here. Absolutely. Now, you did mention, though, and something that I want to follow up on. You did mention that students are not mandated to have vaccinations. We have an assistant principal here, Lauren LaDuff from Warren Easton. Now, you all are not mandating students be vaccinated.
That is correct. Well, our general population is not mandated to be vaccinated. However, our extracurricular students, so like you said, with your son wanting to play football or basketball, he had to be vaccinated. We're doing the same. And many schools across the city actually are making sure that the students that play extracurricular sports are getting vaccinated. And I understand the point that there's so many parents that have reached out and asked the same question: why does my child have to be vaccinated to play a sport, but they don't have to be vaccinated to be at school? A lot of our schools, and I'm very proud of our school district because we've done a really good job in a lot of our schools at making sure our kids are socially distanced. I know for a fact at our school, there are lines on the floor where you walk certain ways so we can kind of keep the kids apart. They have to keep their masks on. Their desks are separated. We've had staggered release times in class, so all the kids aren't in the hallway at one time. But it's different when you're playing a sport because they do not have to have on a mask while they're playing these sports. They're always in close proximity with one another. We had a football game last Friday, and just seeing the fact that, you know, when they have to sit together, like the special teams had to get together and kind of huddle up before they went back on the field, and they're in such close proximity to each other the whole duration of the game in the locker room, on the school bus. It's very close, whereas when they're at school, it's mandated. You have to keep on your mask. And we have several people in the hallways making sure that all students keep on their masks while they're going from classroom to classroom. Our teachers are very, very attentive to our students, making sure that while they are teaching them, that they have their masks on, because our teachers stay masked as well. We have the plexiglass up, so as the teacher is teaching, even with their mask on, there isn't a way. We're hoping, at least at this point, we've taken all of these precautions to make sure that we're keeping everyone safe. I do know that Hurricane Ida, there were some schools in our district that had to already go virtual because there were outbreaks. We were one school that did not have to go virtual because we are very, very adamant about keeping our kids safe. We also have, I can speak for my school, we have a Casper unit in every single classroom, which filters out any particles, thank you, yes.
Particles, droplets?
In the air, anything, germs in general, and it filters it out, whereas the same air isn't continuously circulated throughout the classrooms. And our classrooms don't share air with the entire building. Room 100 has its own classroom, air conditioned. Room 101,
Okay.
yeah.
All right. Now, what about, let's hear from the clinical pharmacist. What about people who sneeze? When they sneeze, they pull their mask down to sneeze, and then they pull the mask back up. Is that defeating the whole purpose of wearing
It really is, because all of the particles are going out. And just a lot of people will pull down their mask, I guess, to talk to you. I'm like, but, I can hear you. But, yeah, the mask is there to keep those droplets in. And when you pull down the mask, they're escaping and, reaching other people.
Yeah, so the converse is true. I hear people who say when people pull their mask down, when they sneeze in their mask, they say, oh, he's so nasty. He's sneezing in his mask. Isn't that just awful? That's what you're supposed to do,
all
right?
his germs, yes.
Yeah, they're your germs, right?
Yes.
And you're keeping them inside that mask. You're keeping them to yourself.
Yes.
All right. Let's move on to another vaccinated person who had COVID, Andrea Jones. You were vaccinated. You had COVID. Give us the background on your experience.
Throughout the entire pandemic, throughout the entire pandemic, I stayed home. I was very, very careful. I didn't go around other people, and as soon as the vaccination was available, I got it. And even with that, I was still very, very careful. But one day I went to an event where there were a lot of unvaccinated people who did not say they were not vaccinated, other people who had been exposed to COVID because right now you have a demographic of people who won't say that they have COVID or won't say that they've been exposed to COVID, and they will still selfishly go around other people. And they did that. As a result of it, I got COVID. I have a pre-existing condition that causes me to cough often. So the coughs, when I was coughing, I didn't think anything of it because I cough a lot anyway. But one day my nose was running, and I was at lunch with a friend, and he brought to my attention that I don't have allergies. I don't have allergies. My nose never runs. And at that time, I was with someone who is immune compromised. I have an 8-year-old niece who I spend a lot of time with. So just to make sure, I went to check. I had COVID. I was terrified because I have a condition where I practically have holes in my lungs. I was terrified.
Holes in your lungs?
I have holes in my lungs. I was terrified. Luckily, I didn't get sick. I didn't suffer at all. At best, it felt as if though I had a minor cold.
Really?
Yeah.
So you and Mr. McCoy must have the same genetic makeup.
See what I'm saying? It's something about that first row. It's that first row. You know, just like in church.
It's
The first row, all right. Is everybody behind the first
That must be the amen corner.
So I did not suffer at all. My nose continued to run a little bit at best. I was in no pain. I had no trouble breathing. And again, I stayed home to ensure that I did not infect anyone. But what happened was, because I'd been around people who don't tell people, don't disclose that they've been exposed to COVID. They just simply don't say, or they don't want other people to know as if though it's some type of plague. I mean, that's something that you should tell people, because you not telling me means that I don't know. So then I, in turn, go around my 8-year-old niece who can't get vaccinated, or around my immune-compromised friend, and I can possibly infect one of them, and they may not survive. They may not be as lucky as Jashad, or as lucky as other people who survived it and who got COVID and lived. But that is my story. I encourage people to get vaccinated, but more than anything, if by chance you are not, you should tell people that. Or if by chance you've been exposed to it, you tell people that, because that can save someone else's life, even if even if nothing happens to you, something can happen to someone else, because like Dr. Eubanks said earlier, it's a domino effect, because they touched me, I'll touch you, I'll touch her, I kiss my niece all day, who in turn go to school with a whole bunch of kids who can't get vaccinated.
So we're more concerned here about the aerosol effects or the droplets than we are, the common areas. So I mean, can you catch COVID from the common areas, like the table, the dinner table, or the chair that you're moving back that somebody sat in prior to you, or the utensils that somebody used and didn't wash, thoroughly?
Well, I think in the beginning of the pandemic, everybody thought that, we had to wash down everything, and, we were cleaning off groceries when we got home. And, as they learned more about it, they realized that it is airborne. However, we should be cleaning off our tables and utensils already. So that's something that Clorox wipes should have been flying off the shelves anyway. Flu season, you should still wipe down surfaces. But there's more information, more data out to show that, it's airborne.
Bishop?
We've got a question from Facebook.
Go ahead.
From Amy. And first of all, to Dr. Stacy Green. She's filtering through our Facebook questions. But Amy had this question, and my niece, who works as a nurse in the medical field, had the same concern. When they asked her, they said, you must get vaccinated by a certain date. She called and asked me, what should she do? But her main problem was that there's a rumor going out that you cannot get vaccinated if you're pregnant, and you cannot, if you do get vaccinated, then it will sterilize the young lady. Dr. Jones.
It's really unfortunate that as soon as the vaccine came out, that was one of the major things that went around. That was literally one of the first things I saw. I had a friend who was trying to get pregnant, and she's like, something about it settles in the uterus and doesn't allow for a fetus to implant or embryo to implant, and that is completely false. According to the American College of OBGYNs, who governs OBGYNs, the American Society of Reproductive Medicine that does IVF, like patients who can't, or people who can't get pregnant and kind of implants the eggs in the uterus for them, and also the Society of Maternal Fetal Medicine. All of them have come in and agreed and looked at the studies, looked at the genetic makeup of the vaccine, and there is no evidence that this vaccine can cause fertility issues, cause miscarriage, or cause any problems with the fetus or pregnancy. First of all, that's the thing with information. We live in social media era where a lot of things anybody can stand up and spew out anything. And I think, she could probably attest to the how the vaccine was made more than I. But when she said it's an mRNA vaccine, what that means is, so in our bodies, DNA is inside of our cells, inside of a compartment inside of our cells. It is transcribed to RNA, which goes outside of that compartment, and then that is translated to proteins. Proteins do everything in our bodies. It's enzymes, it breaks down food. Everything you can think of in the body is required, a protein is required. So when we say that the vaccine is made up of mRNA, that means it's not DNA, and it does not go into that compartment where your DNA is. It goes inside the cell when it's injected, and it releases the mRNA that then translates to the protein that looks like the COVID protein. So you're not being injected with vaccine, live or dead. When there are vaccines that you are injected with live virus, and there are vaccines where you are injected with dead virus. You are not infected with anything COVID related other than something that looks like COVID. Mm-hmm. So to your body, this protein looks like COVID. And so then your body mounts an immune system that comes up, and you develop antibodies. Just like if you get a cold, just like if you get the flu, your body produces antibodies to fight it off. So this fake look-like protein is in your body now. Your body creates antibodies, and now when COVID does come in, it's like, oh, I recognize that. I have antibodies to that. I'm going to fight. So it's basically just giving you a running start. So no, it does not. We suggest all pregnant women get vaccinated with the COVID vaccine. 30% of pregnant moms who are infected are hospitalized. It is your body when you're pregnant, your immune system is already down. So it's an immunocompromised situation. So like we say, pre-existing condition. Pregnancy is a pre-existing condition, and you wind up with pneumonia. You get on the vent, like he said, it's highly likely you're not coming off.
Mm-hmm. That was a great question, Bishop. So we are streaming live, so if you have a question, type it out, and they'll get it relayed to me or the bishop, and we will certainly ask it. Mr. McCoy.
So I just want to ask her about what she was saying about pregnant women. You suggest that pregnant women get vaccinated, but then you say children under a certain age shouldn't get vaccinated, but you essentially vaccinating the child too, correct?
So the antibodies do pass along to the child, which is great. Again, there's no evidence to show that it affects the child. The reason that we can't vaccinate children under 12 is because we can't study children under 12. Just like, honestly, the vaccine wasn't studied in pregnant women either, because you can't give something to a pregnant woman and say, I hope you do okay. That's when ethics come in, and it's like you can't mess over people like that. But yes, for the first few weeks, when a baby is born, it does have the mom's immune system. Yes.
Right. So, so I just want to speak to like side effects, and that's just from I have family members that have taken the vaccine, and they regret taking the vaccine for. So I'm gonna say 2 women in my family, since they've taken it, they've been having a cycle since they've taken it. You're talking probably 6 months of off and on bleeding, maybe 3 days not bleeding, and I kind of feel like you. So when you say, all right, everybody get the vaccination, and you understand that they have side effects, and you say, oh, well, the number of people that have side effects is small, so we still suggest everybody take it. I'm gonna let you answer that.
Go ahead.
And
Go ahead.
all right, and so you say the number of people that have side effects or serious side effects or whatever it may be is so small, we ain't gonna worry about them people. I mean, it's essentially what you're saying, because if you got side effects and you're saying we know it's possibility you could get side effects, essentially you're saying, I don't care, take it anyway, and we'll
No.
find out if you get it.
No, what we're saying is so yes, I do have patients who have abnormal cycles after they take the vaccine. That is true. That is very true. There has been shown there is an association. But I also have people who have abnormal cycles when they take steroids. And I also have people, so should I let them die in an asthma exacerbation and not give them steroids because their periods? So which one's worse? The asthma exacerbation, intubation, death, or your period being off for 3 months?
COVID
So that's
not
how,
always death, though.
it's not always death, but how am I gonna know? Because
Exactly.
I have 11-year-olds who are dying, who have no immune compromise, who are not immune compromised. Then I have you who did fine. How am I gonna know? So which one's worse? Let me see what happens and let them die, or let them have an abnormal period. So when science says it's not no, don't worry about it, it's always does the benefit outweigh the risk? The benefit of you not dying outweighs the risk of you having an abnormal period.
Let's talk about the side effects. What are they? And what's the likelihood that somebody's going to have a side effect?
Well, can we look them up so we can have them in front of our face first?
They
What
have.
they have?
Well,
we ain't gonna just roll with y'all like that.
Hey,
I need to see for
But we're literally the experts. We got
just for you, we brought in experts.
But I
Just-
need to
just
know.
for you.
I would need to verify what side effects.
CDC.gov
Yeah.
/COVID.
But you can't believe them people either.
Okay.
But go
But who
ahead.
you gonna believe?
Before I answer that, I do want to say, have you ever taken a prescribed medication in your life?
I have.
Do you know the side effects?
I do.
All of them.
But they have a whole bunch of them that I will not take because of side effects. I actually got shot and didn't take the pain medicine because I didn't like the side effects.
But did they give you an antibiotic?
I don't know. Yeah, they did. No, they did. Let me tell you, I'm not totally against.
Gangrene,
I feel like
limbs and fingers coming off, possibility, allergic reaction.
yes.
Get them.
Go ahead.
So what I want to stress is whenever you take a medication, there are going to be side effects. The responsibility of a drug company, when they are manufacturing anything, any medication, drug, they have to list every possible side effect. I mean, legally, they're responsible for that. The amount of people that experience a side effect varies. So you could have dizziness, nausea, fever, all of these things that occur when you take the vaccine. Some people will have it, some people won't. There's people who said, that they felt horrible. There are others who haven't. It varies in the person, but they do report all the side effects. I mean, it's the same if you take an antibiotic. Some people get diarrhea. Some people throw up. Some people are fine. Blood pressure medicine. There are some blood pressure medicines that will cause you to have a life-threatening reaction. You can lose your hair. Yeah, there's a lot of side effects associated with, I don't know any medication that does not have a side effect. But again, benefits outweigh the risk.
Yeah,
Based on what, though?
The vaccine made me bald.
But
Yeah,
based on what?
There you go.
Yeah, well, I mean, I saw you before that, and I think God had did his work. But but I mean, are any of the side effects death?
No one has died.
No.
one has experienced
No
it.
one has died.
No one has died from the vaccine.
Not
No
one
one
person.
has-
No.
No.
I don't believe.
No.
I,
Don't you think it would be advertised if they
yeah,
did?
just like we.
What do
I
you
think
mean?
The one big
People
thing
have
that,
died?
The one big thing that they do have out is the Johnson & Johnson. 7 out of, I think, 1 million plus women had a reaction, a thrombosis, meaning blood clots and low platelets. 7 out of 1 million. But how many of the people have died from COVID? So we have just in the United States, up to date, we have about 600, 700,000 people who've died from COVID. So if I tell this woman and that woman, okay, so it's a 7 in a million chance you may, with one vaccine, get a blood clot, but there's 700,000 have died. The reason the hospitals are overrun, we have no space. I was telling her, for patients, it may seem harsh when we send you away or when you are in a hallway but there's literally no space. They're turning our ORs into rooms. They're turning waiting rooms into patient rooms. There's no space. We're putting campers outside to line beds up because there's nowhere for you to go. So the reason we tell you don't come to the hospital, one, you could get COVID or it get worse, or two, there's no space for you. And 90 to 95% of you are unvaccinated. They are now calling this the unvaccinated pandemic. Because
Why you think?
Because you're unvaccinated and 90
No,
to 95% of you are
that's
hospitalized and dying.
You're not telling the whole scope of what it is.
What's the story?
All right. So listen to what you're saying. If you got half of America vaccinated, why are hospitals still overrun?
Because just
No, that don't make
Well,
sense.
for one, the hospital is overrun because it's people who have not been vaccinated who are coming in.
Yeah, but listen, you got half of the people. Before, you had everybody. The whole country was
Shani,
scared.
have you ever
and
taken have you ever taken an antibiotic? What's
Yes.
the one thing your doctor always tell you when they give you an antibiotic?
Tell
Take
me.
all of it. So
Okay.
why do they tell you to take all of it? Because just like us, your child look a lot like you, but don't look exactly like you. Because as things morph and grow, they develop resistance. So if only 50% of the people are vaccinated, so this virus has gotten into an unvaccinated person or a vaccinated person and said, oh, they took them shots and they kept rolling. And they develop another variant of itself. I'm going to reinvent myself. I can't stay like, it's all about do or die.
Which
Darwinism.
essentially means that the vaccine don't work once it morphs, right?
Well, the reason it morphed is
Because of the vaccine.
No.
You just said,
Because
all right,
of the
hold on.
lack
So
of
listen to me.
vaccine.
Understand what you're saying.
The-
We have a vaccine, right? First you got COVID. You treat what you know as this particular COVID, whatever you putting into the body. Once it morphs, that don't work no more.
It's still showing.
No,
it
you're
still
not
shows,
immune. That's why vaccinated people are still getting it because it's
Okay,
they're not
I
dying.
think the challenge, though.
How do you
and
know?
They're
This
not
is
dying.
because the
this is
numbers
what we
tell
said
you
in
so.
the beginning. This is what we said in the beginning. This is so critical to understand. The most important part about this, in the beginning, the whole idea about getting vaccinated was whether or not you're going to get COVID. That was the whole idea. And it wasn't clear then. What's clear now is this, that even those persons who are vaccinated, you still may get COVID. But in Andrea's case, Andrea's a prime example of somebody who got COVID, who had a compromised immune system, had a challenge with her immune system, had a challenge with her lungs, which is what COVID attacks, but she didn't get very sick. In Sheikah's case, okay, not yours, Shida, but in Sheikah's case, she was not vaccinated. She got COVID. Norman got COVID, and it brought them through hell. What we are trying to prevent is not necessarily, we hope to God that nobody gets COVID. But if you happen to get it, we pray to God that you're not admitted into the hospital and they jamming some iron down your throat. I thank God that you are in the condition or whatever it is, but we know people that are in perfect physical condition that got COVID and ended up in the hospital. That's the key. And somebody else said it online. If the big deal is vaccination, why are people still getting it? We understand that. It will reduce the chances of you getting it, but it minimizes your chances of being put in the hospital and getting very, very painfully sick.
And I also wanted to add, if you receive the vaccine and you get COVID, the chances of you developing long COVID, which are the symptoms after you recover from the virus, are less. So if you're vaccinated, the long-term effects have been shown to be less.
I think that's critical because somebody did mention that. What are the long-term effects of people that are not vaccinated? That's a question.
I mean, they can tell you they still have symptoms.
Yeah.
They still have
She can
I
definitely
do.
tell you.
I do. Because I'm a foodie. I'm an extreme foodie. I love to eat. My taste buds are extremely off. Like sometimes they feel like it's burning. You know, like how you eat something really hot and you burn your tongue because you was supposed to let it cool off. That's how it feels at times. Or sometimes I can't smell my house. I love to smell candles and I can't smell it. And it was very, very, very severe for me. And I was one of those people who went to the hospital while I was sick because I couldn't bear what was happening to me. I was like, what is going on? To where I answered the phone. Bishop and Pastor Fran called me, and she asked me something. I could not stop coughing after one word. And it's a cough where it's continuously to where you're sipping air back just to try to breathe to say something, to where she had to speak herself off the phone because I couldn't speak anymore. Where you couldn't walk, your body is I was like, I need to go to the hospital. And when you get there, it does not have room. They literally walked around and asked for names. People are sleeping on the little couches. You have homeless people in there. You have everybody. You have babies in there. They had a lady on her knees screaming. You hearing things that is unbearable. So in my mind, I'm like, I don't want to die in here. Because for me, empathy is one of the things that we learn in the medical field, but it was very hard for people to give that when you have all these different personalities because people are in pain, so we become irate. But for me, I was puking everywhere. Like I didn't eat anything.
Oh, yeah.
I couldn't swallow anything. So everything was acidic. So everything in my body was just coming out. And for them, they're like, oh, all the COVID patients over here. And they throw me over there. And this is a lady who had an accident, who had a cast, like a fractured neck and bleeding from the mouth. She don't have COVID, but I do. So I just built the strength in me just to will myself. I was like, come get me. Because at this point, I'm in there for 6 hours. I was going to be sleeping in there. But then again, I thought about this because after all of the process and everything, in order for my daughter to go back to school and my son, they had to all have a negative COVID test. It was very difficult for me because once we took the test and I got my results back, because my daughter had the pink eye, who I got it from, who spread it all. So we took the test. All of theirs came back negative, and mine came back positive. But mind you, I goes to the emergency room because of my sugar and my pressure is extremely high. And I can't leave until after all of the EKGs and the x-rays for all of the blood clots and everything. Now I have a negative test. Now I take a rapid test. I have a negative test. But the test they sent off came back positive. So it was very frustrating. So where I had to go and take another test.
Did your kids get COVID also?
Yeah, Aspen was like me. And she had a respiratory infection with a pink eye. And it started from the pink eye. And we went, and I was like, my baby, he was like, did she have any cough, runny nose? I was like, no, she's fine. Nothing's wrong.
So, Lauren, let me ask you a question. The challenges at school, I mean, your school is maybe an exception to the rule. But I know you're hearing some stories about what's going on in schools with, what is the general consensus of what's going on with school with this disease?
I can't really say that there is a general consensus because it seems as if our entire population of stakeholders within our city are split in half. So you have people who feel like this is really dangerous. Our kids cannot be in school. The demographic that we have in our city, a lot of our kids live with their grandparents. So, grandparents are afraid of their grandchildren going to school and then bringing something home. So a lot of people really do feel like, the kids should not be at school, that is not a safe place. Where you have another half of people who feel like my child will not learn and matriculate properly if I continue to force them to learn virtually. Because a lot of our parents, again, a lot of our kids are home with grandparents, and they can't give their kids the one-on-one attention that a teacher can. Contrary to popular belief, anybody can't just be a teacher. It takes patience and a true skill that we're taught, to be able to break through to kids on different academic levels and making sure that all of them can, reach their maximum potential. So when they're home with their parents, when they're home with their grandparents, a lot of these people feel like my grandchild is going to get left behind. They're going to have to go to summer school. They're not going to graduate on time because they're learning at home. And there's so many distractions at home, right? When I was in college, I could never study at home. I would have to go somewhere else because I would end up taking a nap. So, it's so easy for kids to get distracted when they're in their comfort zone. So there really isn't a consensus. It's kind of like two groups of people kind of going back and forth with one another because no one really has the answer.
Mm-hmm. I want to explore the long haul effects of COVID. Somebody who had COVID and somebody who was cured of COVID, but still experienced some after effects, some deleterious after effects. Like me, for instance, I sweat profusely now. I never did before. I have very limited stamina. I get winded very easily, and I suffer from fatigue. I got to take a nap in the afternoon. I just got to do it. I never had to do that before. In fact, I went out the other day to clean up some debris and pick up limbs off my property and passed out. So what are the long-term effects that people like me in this room who've had COVID experiencing? Andrea, are you experiencing any long-term effects? You're lucky enough, even with holes in your lungs, you're lucky enough, Doc.
Nothing at all.
Nothing at all.
Nothing at all. I cough about as much as I always do.
Mm-hmm.
All of the things that Sheikah said that she experienced with the loss of taste and the loss of smell, those were things that I was prepared to happen. I was waiting for me to lose my taste. It never happened. I was waiting to not be able to smell. Never happened. I was waiting for my body to start to hurt. Never happened. And even now, I feel just fine.
Dr. Eubanks-Jones, what kind of stories are you hearing? What kind of experiences are your patients sharing with you and those who might be suffering from long-term?
I have a wide array of patients, as I see young girls to older women, but some of my patients, especially the ones who've had severe infections, like been intubated, learning to walk again, weakness, fatigue. Some of them, it's been months since they've been better and they still can't go back to work because they can't walk from one end of the hall to the other. Kidney dysfunction, hair loss. There's a wide array of months later that these people are affected, and it's not just a loss of smell, loss of taste that could be prolonged further than your initial infection, but severe life-altering, just can't complete daily activities of living because they were infected with COVID.
Is there some over-the-counter medication that people like myself can take to kind of arrest these long hauler effects that we're having?
The only thing that is recommended is the guaifenesin or the Mucinex, which can be used for cough, for the lingering cough. But other than that, there's nothing.
Other than that,
you can do pain medicine, Tylenol if you have the fever, just things to treat the symptoms.
mm-hmm. Am I stuck with that the rest of my life, or is this likely to wear off at some point?
We don't know.
As far as we know.
We don't know. Like, we don't know nothing. We don't really know. We don't really know long-term effects.
I'm with you. I'm with you.
That's true,
Trisha.
and that's the unfortunate thing.
Right.
We don't know the long-term effects of the vaccine, and that's what I tell patients. I can't tell you in 50 years, there won't be a commercial saying, if you ever got a COVID vaccine and you're experiencing this, and this, please call our office. I can't tell you that, but what I do have right now that's scientifically proven, and it's unfortunate that all of a sudden everybody's a scientist, but what I do have right now is 90 to 95% of unvaccinated patients are in the hospital. 90 to 95% of unvaccinated patients are dying. So if you tell me that I only have a 5% chance of not being into the hospital, and I only have a 5% chance of not dying just because I don't have a vaccine, for me, my choice is I'm going to get it. But everybody's different, and I understand that.
So, all right, so I'm going to just tell you my last little piece of why I feel the way I feel.
I don't believe that.
Well, it might not be the last one, but no, but really, hear this out. Why, like when they just did the mandate and everything, the people who not mandated to take it is the people who telling us we got to take it.
Who's not mandated? As such as
nobody in the Congress don't have to take it. The people who
but
work
your
for
president took it. You think that?
no, we talking about
I'm just saying. But
they not mandated to take it. The Congress not mandated. Pfizer employees, Moderna employees, none of those people are mandated. Something is wrong with that. If you the person who making it, you telling us it's okay for us to take it, but you ain't gonna take it. That's like working at a restaurant being like, boy, I don't eat there. Something wrong with that.
But let me ask this question: is that true that the Pfizer people are not mandated? Yes. Is that true? Yeah. Look it up on the internet, and the internet will tell me.
I can't speak on the Pfizer company and what they're doing. I know that the same reason why we are mandated to get the flu vaccine is the same reason we meaning healthcare community should be mandated to get the COVID vaccine, is because I touch on average 30 to 35 people a day who are sick. You are coming to me because you are sick. I am in the OR. This morning I was in the OR with at least 8 people that I could expose. The reason being is because my job is to heal you. But unfortunately, my job also mandates me to be exposed. So if I come, I'm just walking through the hall, I maybe walk past 50 people going to get some lunch. So if I'm not mandated and I don't wear a mask, and then your grandmother or your mother or your wife comes to see me, and I'm all willy-nilly coughing, excuse me, and touching their breast and checking their body, and they get COVID, how mad would you be that the doctor who was supposed to heal her hurt her? It is possible.
It's not impossible.
No, it's never impossible. But if I could prevent it. Yeah, but we're talking
about somebody telling you to take it, but they're not mandated to take it.
They're not touching the same 30 to 35 people a day that I'm touching.
That's not what I'm saying. I'm saying where the mandates are being handed down from. All the people, the government, Congress.
But honestly, it's not even the government. It's the auctioneer decided to cause that mandate. Companies have a choice whether or not they mandate these vaccines. So just like LCMC, they don't have that mandate right now. Auctioneer chose, the people at the top of Auctioneer chose that because their employees are doing this work, they should. But what else? What should they do? Should I not get a flu vaccine?
But they didn't have it, and they treated patients the whole pandemic without the vaccination.
They what?
You treated patients the whole
and a whole lot of people that
without the vaccination.
A whole lot of nurses and a whole lot of doctors died.
And they still dying.
And they are, because you want to know why? Because they're unvaccinated.
I mean, that's up for debate.
It's not. It's the numbers.
It is.
Numbers don't lie.
They do.
No, they don't.
So you're going to respectfully disagree on that point, because we're not going to change his mind, and he's definitely not going to change our mind. So we will move on. Let me ask this question, starting with Pastor Love, and then moving down the line. How many of you are comfortable with dining out and then taking your masks off while you're eating in restaurants around other people in close proximity?
You waiting for a show of hands?
No, I'm waiting for the...
I'm not very comfortable. I'm not very comfortable because I can only be responsible for me. I know for certain that Fran Love has been vaccinated. but I am not for certain about the person that may be seated in the areas around me. So for me, I am not very comfortable. It's a challenge for me too, because I am a very touchy-feely, warm kind of person. And so being in a position of leadership here at the City of Love, I am used to touching our congregants. I can't really do that, and it's very uncomfortable for me. You know, we tell people in ministry about the power of unity. And then the pandemic, and then the pandemic hits the globe, and so now we're teaching people about division. It's difficult for the mind to accept that when all of my life, my Christian life, I've been taught how important it is for us to come together. And now we are being taught that it's important for us to separate. It's a challenge. And I agree with you on some levels about your decision to not be vaccinated. But for me personally, I'm uncomfortable around people that aren't. But it's your choice.
Bishop?
I'm learning how to live with it because it isn't going anywhere. It's here now, and there's a possibility that it could get worse before it gets better. So what I had to do to be able to have a forum like this and to be able to minister to people was to put myself in the best possible position to be able to deal with it on both sides. Everything from the vaccination to a diet change, to staying as healthy as I can, from being in the sun, drinking water. So I'm looking at it from both perspectives. But I am learning, and we are learning, the best possible way we can live through it, because I see it coming down the line where eventually they're going to tell you you can't travel without a card. You're going to see times where you won't be able to do the normal things that you're going to be able to do. And of course, no one's trying to force that because, again, people will rebel against it quickly. But I do think that slowly and little by little, as we have mandatory vaccinations to get out of a hospital, this is going to be something that is just going to have to get done across the world in order for us to at least reduce the deaths that people are experiencing through this COVID-19.
Doctor, how comfortable are you?
I'm not comfortable. We used to eat out a lot, before the pandemic, and I'm just very uncomfortable. If I do run in to get something, I make sure I have my mask on. I have attended some events inside of restaurants, but I was paranoid. I couldn't really eat or enjoy my meal because I was worried about whether or not I was exposed. So for me, I like to dine outside right now.
Outside?
Yes.
Yeah. Dr. Eubanks Jones?
I think we're all a little uncomfortable and uneasy with being close to people in general, regardless of if it's here or if it's a restaurant. But I do appreciate, fortunately for me, I do appreciate the mandates in the rest, because to the restaurant world, to me, is like healthcare. You're touching so many different people at one time. So I appreciate the restaurants that are requiring patrons and workers to have their COVID vaccine and have their cards ready to access. So I have attended events, but they're few and far in between. And I picked the corner booth that nobody's coming close to or walking past, and I have my hand sanitizer, and I'm sterilizing my own instruments, because I think we all are a bit more cautious now about the exposures to ourselves and our families.
Ms. Liddell?
I love eating out. I love it so much, okay? I love it so much. It's my favorite pastime at this point because it isn't something that we do very frequently anymore. And just like Dr. Eubanks said, I have attended these events, dinner parties maybe, or sometimes my fiance and I will go to dinner, but it's not as frequent now. And I'm I frequently wrestle between two realities, I guess you could say, because both of my parents are retired. Both of my parents got COVID in March of 2020 when it was brand new and we didn't really know much about it. And they have a lot of underlying conditions, and I was literally afraid for both of their lives. And now that they are better, their favorite thing to do is to go to the casino. So we went back and forth with my sister and I against my parents, telling them, like, listen, it's very selfish of you to do these things, because if something happens to you, what about us? You know, why wouldn't you think about us with the moves that you're making around? And my mom, I mean, she made a very valid point, and even if it wasn't a valid point, she's my mama, so I couldn't say nothing. But she said, she named like 5 people, just straight 5 people that did not leave their house, did not live, and still died. And she said, I am not going to spend the rest of my life afraid to live. So I'm going to go and I'm going to be as careful as I possibly can be. But if I'm going to die, I'm going to die. So I'm going to do it. So I understand her perspective. I absolutely do, especially with her being retired. They don't have a reason to leave the house other than to go to the casino. So I'm kind of torn in between. I am very, very cognizant of what's going on, and when I go to places to eat, we're going to make sure that we're sitting outside and we're not near people. But there is still, I mean, the people that's preparing your food, you don't know. You really don't know. You never see those people.
Yeah, yeah. Ms. Andrea Jones, to dine out or not?
I dine out, but I prefer to dine outside. And during the pandemic, I had a bubble of 10 people that were the only people that I interacted with. I ventured out of that bubble and I got COVID. So at this point, I interact with the same 10 people. And if I'm dining, we're usually dining outside.
Better safe than sorry, right? Yeah. Ms. Williams, to dine out or to pass?
I passed because I was the person, I took COVID seriously, but it wasn't at my front door. So I didn't mind sitting out eating. We didn't mind. I didn't mind leaving. And I was traveling a lot. So I was like, oh my God, I come home and bring my baby to an event, and now we all four got COVID. So now, no, we live out of cooler. So now I cook every day for everybody. And nobody is invited. But the people that live there.
Me, myself, and I, and
Yes.
my acquaintances. Mr. McCoy, to dine out or to stay away?
Well, unfortunately, I don't have no choice. I can't go in the restaurant. So if I want to eat, I ain't vaccinated. So they done made the decision for me. So, I mean, yeah, I go out and eat. I mean, when you really think about it, when you listen to everybody talk, they force the vaccine. I think you should take it. It helps, and everybody should have it. But if you go in a restaurant full of vaccinated people and you still scared, you're going to be scared one way or the other. So, I mean, you might well go ahead and keep living the way you're living. I mean, if you really think about it, you're just as scared of a vaccinated person as an unvaccinated person. You ain't going to take your mask off in a restaurant. You're going to do the same thing. So if you feel like everybody getting vaccinated is the answer, then being in a room full of vaccinated people, you shouldn't mind taking your mask off, because ain't nobody going to get real sick. Like, if that's the mentality, like, I got the vaccination, I ain't going to really get sick. So what you took the shot for, if you ain't going to get that sick, you might well just go ahead and take your mask off and just not get that sick.
Well,
I mean, in reality, I mean, you still just as scared with the
you.
shot or without the shot. So, I mean,
I hear you. Well,
that's the way I look at it.
Count me among the scaredy cats.
Okay.
Thank
Will
you.
you die? You might be scared, but
Well, I didn't die, so I could say, you can look
you
at
was
your
scared.
notes and say, but
You
I
was
mean,
scared.
Listen, I'm cautious, but I ain't scared.
Oh, well, that's good. That's good.
I
Because
mean,
you're not supposed to be fearful.
I feel as protected as y'all. I feel like I had it. My
As you
body
should.
is somewhat immune to it at some point.
But why not?
And God bless you. I hope you continue to be safe. I've enjoyed this conversation.
I did want to add, it's not that, when I go out to eat that I'm scared of vaccinated people. I'm more afraid of bringing it home to my 6-year-old son who is unvaccinated, who may die. So it's about protecting him. So for me, it's like,
Right.
based on the studies, yeah, I mean, I won't die, but my son might. So that is why I am apprehensive.
But when you think about the mandate for a restaurant, you going in there, the 12-year-old, they gonna let him in there regardless. So he might have brought it in there. So you ain't never really safe, like, because you can't check a card for a child. So if you come in there with your child, they gonna let you in there vaccinated and let your child in there unvaccinated. It's the same situation.
Mr. McCoy, you missed your calling. You should have been a reporter.
Man, you
You
should have
absolutely
hollered
should.
at me.
You absolutely should have been a reporter. You can have your very own house.
It ain't
date.
too late. I ain't dead.
All right, then. You have another career. I've enjoyed this discussion, and I've enjoyed serving as your moderator. This discussion has gone for an hour and a half, a good hour and a half, and I think we've cleared the air for a number of people who might have had some concerns about where they stand as it relates to COVID and the vaccinations that are being prescribed to prevent it or to guard against it, to keep us from getting really sick and ultimately dying. Bishop and Pastor, the floor is yours. Thank you so much.
Thank you so much, Mr. Robinson. Job well done in keeping us on point and asking very important and pertinent questions. And to all of our guests, thank you so much. Your expertise, your insight, your opinions, they all matter because there are people that really want to know. And right after this, we're going to ask a few more questions offline that we will post that people did ask. But this is what we wanted, and that was an honest conversation about where do we stand with it on every side. And the decision after this is yours. It's your choice whether or not that you do it. Where does the church stand with it? The church stands with the same thing. It is your choice. But at some point, we're really going to have to look very, very carefully at how we're going to move forward and keep as many people as safe as possible, because we believe the church, of all the places in the world, should be a safe place. It should be a safe place where we can do what Pastor Fran has said before, especially with a church like the City of Love. We're very embracive. We're very touch your neighbor, hug this person, hug that person. And I think many times it stops us from being who we are from the core because of this disease. And we're learning how to live with it. We want to be as sensitive as we can to everybody, whether or not they're vaccinated or not. But at the same time, we want you to be as informed as possible so that you can make the best decisions. Again, thank you to all of our producers and everybody that's here, and to all of our panel. Thank you for being with us, Pastor Fran, and of course you, Mr. Robinson, for being a great host. We love you. Get ready for part 2. A lot of questions to be answered. G?